So this is a patient that we finished like 2 years ago, and we take a look at the original scenario of the intraoral occlusion. It's very severe occlusion with skeletal element, and this kind of a patient will have a very strong susceptibility for condylar resorption. So when we finish the case, we have a quite beautiful bite like this. So this is quite a good accomplishment that we have achieved. But the thing is, after like 2 years after the treatment, due to the fact that the condyles resorpting pathologically, so we can see a very increased overjet again. I push the mandible backward with manipulation, and we can see that the increase of the overbite is very evident, right? Take a look. So the molar relationship converts to cusp again. Bite together, bite, close. Good. Take a look. So this is the scenario that we always encounter in clinic. We do have a lot of cases that we finish with a quite beautiful occlusion, with very normal overbite, but with some passage of time, because of the condylar resorption, the mandible retreated again, creating a very big overjet. So for this kind of a patient, we need to have a specially designed retainer to hold the mandible forward. Okay, so we call it Mandibular Repositioning Retention Protocol. So today what I should do is to have a bite registration or mandibular repositioning registration. Okay, so we will instruct the patient to move the mandible forward to a normal overbite with midline on, and then we have to record this position to be able to fabricate a specially designed retainer, which is the clear aligner version. Okay, we call it SGHB. Now, what I should do is to heat the wax, make the wax pattern with the dentitional shape. Okay, so we have to heat the wax gradually, evenly and gradually, and fold layer by layer to make the thickness about like 5 millimeters in thick. And then we shape the wax pattern into such that it will be fit the dental arch. Okay, and then because we are registrating the bite repositioning by digital facility, so we cut off the length of the wax pattern, which cover the frontal teeth area. Open, please open, good. And I have to expose the frontal teeth and its counterpart, its opposing dentition very clearly to inspect the repositioning of the mandible. And just bite a little bit, not too much. Yes. And then in such a position, the mandible is forward positioned. Bite very gradually. Bite a little bit more. So in vertical dimension, we don't need to open the bite very much. Okay, so we instructed the patient to close up a little bit more. Make sure that the midline, the dental midline, is on. Okay, all right. Okay, good. So in such a position, reposition of the mandible, the increased overjet is being corrected. Bite together a little more. Yeah, bite. Good. And then we take a look at the buccal segment that we could see that the molar relation has been restored, and without too much opening of the bite in the buccal segment. So on the other side, the molar relationship is restored to class 1 relationship. So we could start the scanning for the buccal segment, and then we send the digital send a digital recording of the registration to the lab, and they Smartee, and the Smartee company will create a clear version of the SGHB, which is a specially designed retainer, which is used specifically for the patients who have been relapsing with mandibular retrusion due to the fact that condyle resorption takes place. Okay.